Okay, good.
Um, Hello, today we'll be discussing about what is psychology and mental health. Next slide. First, let's give a deep brief. First, let's give a deep brief introduction into what is mental health and psychology and how it connects to our well-being and behavior. Well, what is psychology? Psychology is the scientific study of a person's behavioral and mental and how they function and act. There are many different types of psychology, such as social psychology, forensic psychology, environmental psychology, and etc. But today we'll be learning about the four main types in psychology. Can you go back? Um, the four main types of psychology is clinical psychology, the counseling for mental and behavioral care for individuals and family in needs. Clinical psychologists can diagnose and treat many different types of illness. Cognitive psychology. Cognitive psychology is the study of the mental process related to perception, language, attention, thinking, memory, and consciousness. They help understand and overcome our problems. They help people who are diagnosed with disorders and trauma. Behavioral psychology based on a person's behaviors from conditional, classical conditioning, and operant conditioning, which is our body's responses to our environment around us. Lastly, biopsychology involves research on the brain, behavior, and evolutions, indicates and studies our sensory processes, learning and memory, motivation and excitement, and including in cognition. Next slide. Now let's talk about mental health. Mental health is our emotional, psychological, and social well-being. It affects how we think, feel, and act, and helps determine how we handle stress, relate to others, and make choices. How does psychology connect with mental health? Well, psychology covers mental health and abnormal functions and behavior, like in mental disorders, with the goal of understanding individuals, group, and social systems. Next slide, please. Here are some early signs and symptoms of mental health problems: smoking, drinking, or using drugs more than usual, eating or sleeping too much or too little, thinking of harming yourself or others, having low or no energy, hearing voices or believing things that are not true, and pulling away from people and usual activities. Next slide, please.
Now for the concepts of mental health. Next slide, please. So what causes mental illnesses? There are several different things. Here we have listed six. The first one is genetics. Instances of sadness and anxiety that have been connected to polymorphisms in genes that control neurotransmitters like serotonin and dopamine. Schizophrenia. Another one is childhood trauma, which is sexual, physical, and emotional abuse during childhood, all lead to an increase in the likelihood of developing a mental disorder. Unhealthy habits. Those who spend most of the time sitting and do not exercise have a higher risk of experiencing depressive symptoms, which lead to mental illness. The environment around people, chemical pollutants, natural disasters, and non-chemical environmental stress all raise someone's risk profile for mental health issues. Negative thoughts. The repetitive negative aspect of rumination can contribute to the development of depression or anxiety, and also stress. This long-term stress can contribute to both physical and mental illness through effects on the heart, immune, and metabolic functions and hormones acting on the brain. Next slide, please. So some features of this topic is anxiety, which is the feeling of fear, dread, and uneasiness. It might cause a person to sweat, feel restless and tense, and have a rapid heartbeat. If someone's feeling down, when you're feeling down or are experiencing low mood swings, our motivation to do things tends to drop, which can affect how we're feeling and lead to other mental illness impacts. Another one is depression, a constant feeling of sadness and a loss of interest, no motivation, which stops you from doing any normal activities that you would be doing. And as well as self-harm, which is the act of purposely hurting oneself on purpose. Some common mental health issues and the treatment. So for anxiety and depression, some treatments you can do or like things to help ease it is medications, taking them, as well as exercising. Positive self-talk and reassurance is also really important. So for schizophrenia, some treatments include medication and also therapy. And for bipolar disorder, some treatments include antidepressants, mood stabilizers, therapy, and also like lifestyle changes as well. For OCD and PTSD, some treatments include talking therapy, just talking it out, and as well as taking medication. And then for suicide, there's a suicide hotline, therapy, and as well as taking medication. For the emotional feeling, Um, for trauma, which can occur, it's a deeply distressing or disturbing experience, and these can all impact how you're feeling. And loneliness is a state of being alone and feeling sadness and feeling like something's missing. For guilt, you can have feelings of deserving blame, especially for imagined offenses or from a sense of inadequacy, feeling like you're not good enough. Brooding is showing deep unhappiness of thought as well as rejection, the dismissal or refusal of a proposal, idea, or anything of that sort. Um, well-being of mental health, it's important to have positive relationships with others. Individually and changing over time, relationships can be difficult to define and also to maintain. But some signs of positive relationships include having respect and trust to build off on each other, companionship and shared activities, which can help you build a sense of community and as well as personal growth because the process of an individual's becoming aware of the self in its entirety, followed by taking steps to address the behavior, attitudes, values, and actions. So people with mental health disorders, people all over the world may experience mental health disorders, which is a common thing, and they might experience them in different ways. Statistics about 19.86% of adults are experiencing some sort of mental illness. 4.91% are experiencing a severe mental illness, and around 26% of Americans ages 18 and older, about 1 in 4 adults, suffers from a diagnosable mental disorder. And some fast facts is that 1 in 4 students have a illness, and around 40% do not seek any help because they don't know how to seek it or where to find the resources. And over 80% feel overwhelmed by their responsibilities. Next slide, please.
Now we will be going over mental health aid that we can do. Next slide, please. Here are some 3 steps we can do to maintain a healthy well-being. Mindfulness. Practicing mindfulness increases the ability to relax, a greater optimism for life, improved self-esteem, and also help reduce stress. Meditation helps you focus on being aware of what you're sensing and feeling in the moment without interpretations or judgment. This also involves breathing methods and guided imagery or any practice that helps calm and relax your body. Building connections. Building connections with people around you provides emotional support and helps you build a sense of belonging. And lastly, being active. Being active improves your well-being by helping you set goals, raises your self-esteem, and can work as a way of a distraction. To be active, could go outside or try a new hobby or hang out with friends or family. Though there are many more things we can do to maintain healthy well-being, here are the top 3 steps that are recommended. Next slide, please. Now let's talk about how we should treat a person with mental health. Here are a few tips we could be doing to help a person with their mental health. Listen to them. Listening empathetically, it allows the listener to really hear and understand what is being said. Do not judge them. It is important and to listen to people with their will wait, sorry. It's important to listen to people when they share their struggles and not judge them. When people hide their mental health issues, since they might have a feeling of being ashamed or afraid of being judged or criticized, listen to them and not judging is the best way for the person to feel comfortable towards you and even if they are struggling. It is critical to listen to what they have to say. Giving support. People offer their experiences, strengths, and hopes to peers, which allows for natural evolution of personal growth, wellness promotion, and recovery. We should support them in any way we can and be there with them through hardships. Lastly, calling for professional help. Professional help can lead to significant improvement in mental health and well being. Mental health professionals can provide evidence based treatment. For example, it could be a specialized therapist or doctor, someone who you feel comfortable that is specialized with mental health and well being. Next slide, please. It is okay to take a break and prioritize your mental health. This saying that our mental health is important to our well being, and you should take your time off to take care of your well being and body. Next slide. And that's it. Thank you.
Thank you.
Yeah, if anyone has any comments or questions, feel free to add them in the chat. But thank you for this presentation. I really like the slides and the concepts that you chose to present. I definitely think mental health is a very important issue in the field of medicine and in general. I think no matter what field you choose to pursue, there will be certain instances that cause you stress as a student and as like in your career, you might experience things that make you like stressed. And it's important to have someone that you trust, that you can open up to and share your hardships with. And it's also important to have different ways to cope with your stress. So some people listen to music, some people eat chocolate, some people go for a run. There are many different ways to cope with stress. And I think it's important to have like an outlet to let go of that stress and then resume and come back to work. And I know like in college there are like exams and midterms and those might be stressful. But it's important to take a step back sometimes. For me personally, I like connecting with peers. And I like spending time outside. So sometimes I'll take a break, go for a walk. It makes me more alert and more ready to focus again. And also like in general, you don't know what other people are going through. So it's important to be kind to others when you see them in school or in passing. Just a simple compliment or a simple act of kindness can kind of make their day a little bit better. And so yeah, it's super important. I'm very grateful that you guys shared about this topic, and you definitely shared some very important information about mental health and different mental health illnesses that people are affected by. And it's super important to raise awareness for these issues. And I know a lot of people are on spring break this week, so I want to keep this short. If you have any questions, I'm happy around to stick around and answer any questions. But if you don't have any questions or comments, you're free to go and have a good weekend and for spring break for those people who are on spring break. And then they also included resources here in case anyone wants to check these out. And we'll send this out in the recap email as well.